Hello, welcome to our expert webinar, and I'm super excited to announce our guest for today. I am Dr. Carla, Doctor of Physical Therapy, specializing in pelvic health and wellness empowerment coach. And today we have our special guest is Dr. Katania Taylor, and I'm really excited for you to be here. I'm going to give her introduction, and then we had questions in the NeuroFit Woman group, a poll of questions, and so those are how we're going to ask all this great information from you today. So Dr. Katania Taylor is a doctor of Oriental Medicine, and she's been practicing for 19 years. She specializes in pain, gastrointestinal health, women's health, autoimmune and inflammatory diseases, and emotional issues. In the past 9 years, she has also incorporated functional medicine into her practice. And this means that in addition to acupuncture, which she does, she addresses root cause treatment of a patient's ailments using a combination of functional labs, objective diagnostics, and Oriental medicine to arrive at a comprehensive treatment plan that includes diet, targeted supplements, herbs, movement, I'm a fan, acupuncture to help the patients heal themselves. Dr. Katania graduated in 2003 from, I hope I'm saying this right, Bastyr University, and has her own practice here in Reno. And she has 2 beautiful teenage kids with whom she loves to camp, hike, travel, and cook. We have so many things in common. You can connect with Dr. Katania via social media. So she's on Facebook, and then also at her email. And all of this is in the link, and I will also put it in the link again so that you all have the specifics to that. Okay, so thank you for being here.
For having me. I'm excited.
Yeah, me too, and it's so great to see you again. So I'm just going to start with the first question off the top, if that's all right. Yep. Because we have about 30-ish minutes. So one thing I wanted to say, that if anyone has questions after the fact, I mean, if we have time today, which I don't know if we will, but if we do, wonderful. And if not, just post your questions in the NeuroFit Woman group. If there's any in the comments today, I will take those, save those, and add them to the group, and then I'll share them with you. Katania, is that okay?
Perfect. Yep.
Okay. So the first thing that was asked is, what is the link between gut health and hormones?
That is a wonderful question. So gut health highly affects hormones and vice versa. So it's kind of an interesting combination, kind of an interesting link. There are studies showing that there is some hormonal, genetic male-female differences they're always studying mice generally, but male-female hormones affecting, what kind of gut flora we have, definitely. There's studies showing that higher levels of testosterone can actually help certain diseases, like preventing diabetes, things like that. Estrogen is a really big one, and I'm sure everyone on here is going to be female, so I think it's the most appropriate. So again, estrogen can affect what gut bugs we have, for the better or for the worse, and vice versa. The gut bugs can have an effect on our estrogen levels. So one of the ways that the gut bugs have an effect on estrogen levels is that they produce an enzyme that can break down or not break down, depending on what we have, the amount of an enzyme we have in our gut, based on that gut bug that makes it, whether or not we clear estrogen. So estrogen is broken down in our liver, and then it goes into the gut to be cleared, because we don't want all of these metabolites and the estrogen breakdowns, the bad estrogens, to stay in the body. So the liver packages them up and sends them to be excreted. So depending on these levels of gut bugs, sometimes they will reactivate some of those estrogens that we maybe don't want to recirculate. And if we have the proper level, they'll leave them alone, and then we'll excrete them. So If we have too much estrogen, which many of you will probably be familiar with estrogen dominance, a lot of diseases are associated with estrogen dominance. Cancer is one of them, endometriosis. We don't want those extra estrogens, especially, like I said, the breakdown, the estriones, the ones that are metabolites basically of the estradiol. We don't want those breakdowns. We want them to leave our body. So we want those good gut bugs to be allowing them to leave. We don't want them reactivating them, essentially. So it depends, basically. If you're menopausal and you're low in estrogen, we might be looking at maybe we do want some of those to recirculate. Maybe we want, some of those hormones not to all leave the body. If you're younger or at a stage where you're estrogen dominant and you are having either endometriosis, cancer issues, fertility issues, several issues that can be estrogen dominance, we want to get rid of those estrogens. So it's a detox process, and the liver participates largely, but the gut microbiome plays a really big role. Now, the problem is we don't just say, oh, pop this probiotic and it'll fix your endometriosis. It's very complicated. And when you look at the research, they will almost always at the end of research say, more research needs to be done. So because it's such a multifactorial issue, sure, you could throw this one, nutrient in there that will stop your body from breaking the estrogens down. Maybe. Depends on where you are in life. It depends on what your liver's doing. It depends on what hormones you're taking. It depends on all sorts of different things. So generally, basically, I would say we want to optimize gut health. And if you're having gut issues, if we focus and fix those gut issues, chances are your gut is going to be working optimally for you. That hopefully all those things are going to be panning out properly. Now, if your gut issues are all fixed up, and we're moving on, maybe we even do a lab that shows us some of your hormones and your metabolites, and you're still not, you're recycling hormones we don't want. There are a few things we can do, certainly, but generally I like to say, let's get the gut feeling good. If you're feeling good and you're having regular bowel movements and you're not having pain, gas, and bloating, generally your gut's probably pretty happy and doing its job. So that's the first place to start. We can kind of fine tune later, but like I said, it's kind of tricky. There's not like, oh, this study showed that this gut bug makes you have hormone imbalance and this doesn't. So let's just take a bunch of this gut bug. It just isn't that simple. So I hope that's kind of a not too complicated answer to that.
No, that's a lot of information. I'm already like, I should have been writing this down. I'm going to re-listen.
Well, it's recorded. So
exactly. So, well, it's fascinating. Like you said, that if we could take care of the gut and then start there and make a process from there. I think that's really fascinating. And I find as a pelvic health PT, I see a lot of gut issues when people have something going on with their pelvic floors. Not to get too off track there, but there tends to be, not always, but oftentimes, like you mentioned, multifactorial, that there may be something going on there that people didn't even associate with their current issues. It has to be with their gut. So that's why this is such a great topic for everyone. Yeah. And I think when it comes to the hormonal thing, it gets very complex, like you mentioned, pretty quickly and very much individual.
Right. And hormone wise, also, most people don't think of hormones, but thyroid hormone and adrenal hormones, they kind of fall under the same category. If you're having a lot of detox issues and then gut issues, you can look to the thyroid. Oftentimes the thyroid gland plays a big role in that. So all the hormones do really play a role. And again, it's always back and forth. It's always mutually, the hormones affect the gut and then the gut bugs affect the hormones. So it's a cycle.
Right. So I'm looking at, I'm just going to kind of go a little out of order of our questions, but hopefully they make sense. Like, so as far as, because and maybe I should have asked this first, I should have put this maybe in a little bit different order than what I have on my page here, but so what is the importance of gut health? I mean, you kind of already mentioned it, but, yeah.
So as I don't know if it was Hippocrates or whoever, those ancient doctors said, everything begins in the gut. And it really, really, truly does. And we're finding out much more. It's becoming more and more clear and provable that our microbiome plays such a huge role in every aspect of our bodies. In fact, it's almost considered a whole organ in and of itself. That grouping, that microbiome, it's called. It's the grouping of ideally thousands of different species of microbes, so bacteria, viruses, even some parasites. If they're all in concert, they're all meant to be there. It's when they get out of balance that it becomes a problem. But we do have microbes, parasites, viruses, and bacteria all in there living ideally harmoniously. And the more science we do on that microbiome and how important they are to our digestion, to protecting of the lining of our gut, there's a whole level of our immune system that is, so if you have a lumen, if you have your stomach, your gut, your tube, that's your gut, it's a very, very thin lining of skin. It's like one cell thick. And that's where nutrients and everything are transported through. It's very, very fine. And so behind that is the immune system. And 80% of our immune system is actually in that surrounding that little tiny thin layer that's around your whole digestive tract. Because if too much gets through, if you have a leaky gut or you have issues, you have a perforation of any sort, you need that immune system there to do its job when the wrong things go through. So it's a very precarious, very delicate system, and that immune system is really, really important there. And on the flip side, it can go haywire if you do have a lot of inflammation, which translates into gas, bloating, burning, diarrhea, all the different gut symptoms we have. We can assume that there's probably some level of issue with that nice little thin lining, and that the immune system is having to kick in and deal with some of those things that are being allowed to come through. So we end up with all sorts of other issues, which I'm sure we'll go into in another question, but you can actually not even have gut symptoms. I keep talking about all these gut symptoms. Certainly that's key, but you can actually have a leaky gut and issues with your gut and not have very bad gut symptoms at all. You could be having brain fog, migraines, keep getting diagnosed with new autoimmune diseases, et cetera, et cetera. So back to the immune system plays an enormous role. And then again, those gut bugs and those gut the microbiome play roles in producing nutrients, in protecting the gut lining, in producing vitamin D. They produce all of our neurotransmitters. I mean, they're literally an entire organ in and of itself, and immunity is probably 80% of their job.
And that was one of the questions, is what is the relationship between gut health and immunity? And you answered it. So, and I think I see that too with my clients, is that oftentimes people they may not have a specific gut issue, but that's kind of where it comes down to. So, like you mentioned, some of the other symptoms, as far as brain fog and other things. With your, so speaking of gas and bloating and those type of symptoms, which we don't really have a specific question for that, but could you talk about that a little bit more? Like, what is that? I mean, because there's a certain amount of gas that's like normal because of how food is being processed, right? But how does somebody know if it's like, maybe it's something they're eating, or maybe there's something else going on?
Yeah, so definitely gas can be very normal. And in fact, I ask my patients this exact question. I say, do you have gas? Is it excessive, first of all, but does it come out? And do you feel okay? Like, do you have a lot of cramping and then you pass gas and you're better? That might be problematic. But if the gas is coming out, believe it or not, as much as our spouses might not like it, if the gas is coming out, you probably did. You probably ate some broccoli. You probably ate something that's feeding the gut bugs, which is what we want. We want them fed. When you have gas, it means they're metabolizing what we fed them, and we need to feed them. If it becomes excessive, if it's really, really stinky, but if it's painful and not coming out. So I think many will relate to the idea of bloating, and then the feeling of like, I just want to push and I wish I could fart, that feeling, and you can't. Mm-hmm. That's when it's a problem, because that's when we have an issue higher up in the small intestine. So we've got the large intestine, which is that last up, across, and down. that is where we really, our colon it's called, that's where we really want the large numbers of microbiome really to live, because that's where, and then that's where that gas might be produced and it should come out, because we're right near the end of the whole tract there. When we have that bloating and that feeling and the pain and the cramping, that's gas that can't come out. And that's because it's higher up in the small intestine, which is really, really long. It's all wrapped up in there. And if we have too much gas and bloating in there, it's because we have possibly too much or the wrong kinds of bugs up high in our small intestine, and not, they've migrated up from our large intestine to our small intestine. That is where we're going to get the cramping and the pain and the bloating, and even the diarrhea and the constipation can actually come from higher up there because of what the gut bugs are doing to our peristalsis, it's called, the moving through of the food through our system.
So either speeding it up or slowing it down, like. Okay. So you mentioned probiotic, and that was one of the, what are your thoughts on a probiotic? Or is it always necessary? Is it sometimes necessary? Is it not at all?
I think
you could tie in prebiotic if you want to, because that's
okay. I think it's often necessary. I think so. If people are having any sort of issues, and I'm going to go into saying, including like a neurological issue that I think has a gut, cause, a gut related root cause. But specifically, if we're dealing with gas, bloating, pain, cramping, diarrhea, all that, we definitely always use a probiotic at some point, maybe not early on in treatment. And we also are very careful when people are very flared up, because they can cause diarrhea, they can cause gas, and they can cause bloating. So you want to be careful. And there are families of them that we use on very sensitive patients as well. There's different types. But at some point in everyone's treatment, when I'm treating gut, there will be probiotics added in. Prebiotics are the food for the probiotics. So they're oligosaccharides. They come from things like bananas, and they come from all fiber. All fiber is a bit of a food for these bugs, but there's some specific ones that really do a really nice job of feeding them. Jerusalem artichoke, which I didn't even know what it was until about 3 years ago, but there's some really interesting asparagus, artichokes. I just read bananas, which kind of surprised me, but there's a grouping of foods and then herbs and supplements, and sometimes they'll be in shakes. There's often like guar gum or chicory. You'll see those in shakes or protein powders or green mixes, and they're in there for their prebiotic and their fiber content. But if you've got a person, if you or your patient or anybody is taking something like, I eat so well, I'm just taking, I just added in just a green smoothie, there could be those prebiotics in there giving them their symptoms. So we want to, again, you just want to be really, really careful with sensitive gut patients. That said, a healthy person who really doesn't have gut issues, or you've technically hopefully healed them, we do want to have those prebiotics in there, because actually probiotics, they find they don't seed, they go in, they can do their job, but they don't really live. And most of them don't seed, which means they don't start a family, right? They just go in, they'll do what they're supposed to do, but then they die and then they're passed. So what the prebiotics, the food, is key, because if you're always eating a certain amount, you're feeding what's there and you're making them healthier. So all symptoms aside, as long as you're not very symptomatic, I would never tell a symptomatic person up their prebiotics. That's like, in fact, those are when we're going to get to talking about foods to remove. It's actually prebiotics, and it includes a large number of vegetables if you're highly symptomatic. So back to your answer, most people I'm treating on a probiotic. Anyone who's been on an antibiotic, I would always do at least a month or 6 weeks course of probiotic after that to help reseed, which I just said they don't really reseed, but you got to get something in there to help. Right. And then kind of focusing a little bit on those prebiotics and the vegetables and stuff like that, as long as those vegetables don't give you issues. So pre and probiotics, someone like, assuming you, Carla, maybe you have no issues at all, I'm sure you're going to be eating your vegetables. And then every now and then, I'd love to get in there some fermented foods. That's always a good way to go. Our ancestors ate many of all foods, not just vegetables. I mean, think of Sweden, and they ferment fish. Like, have you ever heard of those cans they open? I've never seen it. It looks horrifying.
I think that's the lutefisk, but my mom was from an area that didn't eat lutefisk, but it's the stinky stuff.
Right. And so our ancestors, by the necessity of Fermentation was in place of refrigeration. But we evolved with that. And by evolving with those things, we become to need those things. So that's one of the reasons why, over time, we work now with probiotics, with things we get from our diet. And our ancestors were eating way, way, way more fermented foods.
Oh. I didn't think about the fermented. I mean, I go like kind of back and forth, but you think about things like, because that's like kimchi, right? And sauerkraut and
Yep. You can ferment any vegetable. I always like to tell people to go to Whole Foods because they have such a great selection. You just go to the refrigerated section right next to the vegetables. There's fermented carrots, fermented beets, they'll have a spicy combination, pickles. Now, pickles off the shelf, those are not fermented. Nor are all refrigerated pickles fermented. If you look on the label and it says vinegar in there, they're not fermented. The only way you know they're fermented, they usually will say fermented, but they'll say raw. They'll usually say raw, R-A-W, raw, and fermented usually is the wording on there, but there's a few brands. So anyway, pickles can be fermented, cabbage can be fermented, salsa can be fermented. You can literally ferment almost anything.
Okay. I like it. So, you've tied into so many of these things. Lovely. Foods. So we had, there's two different things here. One are foods that are helpful for digestion. I think you were focusing in on those already. And then the foods to avoid.
Okay.
For gut health and digestion.
Right. And so as I've already kind of indicated, some things that are helpful at a certain stage might be harmful if you're very symptomatic. So probiotic foods, for example, you want to introduce them really slowly, especially if you're symptomatic, because they are just going to, they're helping augment those gut bugs. Those gut bugs are what are creating gas and pain and bloating. So if you can't eat a probiotic food, if you can't eat a fermented food because you get gas and bloating, then you've got to back up and start over or seek help or something like that. But any way you cut it, you should start small. Don't go doing 5 tablespoons of sauerkraut in a meal. So foods to avoid if you're extremely symptomatic. I mean, I'm talking, I have patients that are having diarrhea 15 times a day. They're bloated like 3 months pregnant, cramping, pain, I'll give you the extreme. I start them on like a broth with a cooked meat, like a chicken or beef, and one vegetable like butternut squash or carrots, well cooked in that broth. And that's all they eat for a day or two. They're going to drink that broth. They're going to eat, you can eat meat. So some people think they can't digest meat, and there are other problems that is not part of this topic today necessarily, but meat is actually the least inflammatory to this whole process we're talking about right now, because it doesn't really feed the gut bugs at all. It doesn't do a lot of inflammation. So meat is actually, so a broth and a meat and like a one vegetable, like I said, like a butternut squash. So then from there, in severity, there's foods called FODMAPs, F as in Fred, O, D as in dog, M as in Mary, A, P, S, FODMAPs. They're fructo oligosaccharides, monosaccharides, polyols, and something else. But if you Google FODMAPs, you will get a list of foods that are high FODMAP. They're highly fermentable, which means they're going to feed those gut bugs and they're going to cause symptoms. Now, feeding those gut bugs, remember, we want to feed those gut bugs, but some of us are too messed up to be feeding them right now. And then there are some of us who actually, if I eat like a Jerusalem artichoke, I would probably die. If I ate, 5 plums instead of 1 plum, I'm hurting. So some of us just we're always going to be more sensitive. We're always, not everyone needs cups and cups and cups and bowls of fiber. That's also kind of a misnomer. Like, I'm eating such a healthy diet, and they're vegetarian and they just eat 5 salads a day. If you're having gut symptoms and you're a vegetarian living on wheat and salad, that's probably your problem. So fiber is what is the problem, really, unfortunately. I know it's a healthy food and we're going to try to get them back in there, but fiber is feeding the gut bugs. If you've got gut bugs, bad ones or ones in the wrong place, causing the bloating, pain up higher, then they're having a party in your small intestine, and we've got to cut back those numbers, reduce their food, which is many vegetables, FODMAPs in particular. And then we would do a protocol, generally herbal. There are some antibiotics, but we would do actually a protocol to kill back some of those bugs. And then we would rebuild the gut lining, and then we would slowly reintroduce some of those foods. But becoming aware of the foods you can't eat at all, or that you can only eat a little bit of, is really, really important. And fiber really is number one. Everyone hears about gluten. Gluten's a fiber. If you're really symptomatic, we're going to be cutting out gluten. If you get healed and you're not too bad, you might be able to be okay with sourdough or a little bit of bread here and there. Some people, especially if they're celiac, which again is a whole other issue, gluten's a huge issue. But fibers, so then that includes fruits sometimes, the breads and the wheats. Dairy is also another big one, and that's a little bit of a different issue, but dairy, so those are the top: gluten, dairy, and then the fibers, which is everything, which is all those plants, right? It's the fruit, it's the grains, and it's the vegetables. Garlic is a huge one for people with bad gut issues. Garlic and onions, they're high FODMAP. Those artichokes, those Jerusalem artichokes, all the things I told you were prebiotic foods,
Right.
chicory root, inulin, FOS, you'll see on the back of some probiotics and sometimes in like green smoothies. FOS is fructooligosaccharide. You do not want that in there if you're having these issues. So avoiding those foods and going very simple and cooking your foods better. So more cooked vegetables. A ginormous green kale salad full of, all these vegetables is probably not going to be very helpful in the short run.
Yeah, it's interesting that you mentioned that, and I think it's because I've noticed that myself. I used to eat a ton of vegetables, and I tell you what, I eat a lot of vegetables, but I don't eat near what I did in the past, and I always feel better because I was over, like, right. I'm sure.
And everyone, doctors and including GI docs will often just say, oh, the cure to everything is fiber. And it's not, it really isn't. It's very individual. It's like a desert. If your body terrain is like high desert, like let's say here in Reno, if you got 20 inches of rain, we're going to have floods and chaos. If you're a rainforest and you get 20 inches of rain, it just soaks right in. It's perfect. You're totally ready for it. Our systems are like that. We're as individual as anything else. Yeah. Our systems are very individual, and some of us are rainforest and some of us are a desert and some of us are somewhere in between, and you need to figure out your level of fiber primarily. And then there's going to be a few, trigger foods, like I said, dairy or strawberry or something random for some other reason, but fiber is a really big one. So you need to figure out what's right for you.
Yes. And I do see that with my clients too. And I send them to you, and so, and I do have a question. This is one, it's not even on there, but I don't know if you speak to this, but, as far as like, cause I think you and I've talked about it, like gastroenterology. So this is what I usually tell people as far as say the difference of going to see you as opposed to maybe seeing a gastroenterologist, is that I usually say that they're typically looking for something specific pathology wise, the gastroenterologist and they're not going to give specifics on diet typically, in my experience. That's my experience.
They're getting a little bit better. They're actually starting to admit that what we put in here affects down there, which it goes through the same tubes. So it's crazy not to realize that, but they're starting a little bit. There are some gastroenterologists recommending the FODMAPs diet and stuff like that. I definitely, if someone's severe in their symptoms and they come to me and they've never seen a gastroenterologist, I might try to help them. I mean, I certainly would try to help them, but I do like to rule out. I mean, the good thing about going to a gastroenterologist is you're going to be ruling out Crohn's disease. You're not often going to rule out celiac, even though they might do a blood test for it, but there's a lot of tests, and that's kind of a whole other topic. It's very hard oftentimes to diagnose celiac disease. A blood test alone is not usually accurate, but they'll rule out Crohn's disease, diverticulosis, diverticulitis, cancer, all the bad things, an ulcer in your stomach. If your gallbladder's bad enough, they'll find that. If it's not bad enough, they're not going to find it. And you could still have gallbladder issues. Usually the blood test can rule out like pancreatic insufficiency. So anything really, really major. If you have longstanding issues, I generally recommend, let's get all that ruled out. A stool sample, some blood work. I hate colonoscopies, but some people have to do those. But yes, as far as diet and treatment, and another thing that's new that GIs are starting to treat is something called SIBO, which is small intestinal bacterial.
I've noticed that recently, that more people are
And that is actually what almost
testing for that.
everything that I'm talking about, because they're finding 85% of IBS is actually SIBO.
Okay.
So pretty much almost everything I talk about and treat is, I almost assume it's SIBO. Like, I mean, I'm treating stomach stuff and gallbladder stuff, but so many people have SIBO. So GIs are starting to treat that, and they do have a pretty good test for it. It's not really gold standard yet, but it's a pretty good test for it. It's a breath test, which is kind of nice.
Mhm.
It's not invasive. And they'll diagnose SIBO and they'll do antibiotics for it. And it's highly effective. Now, the problem is that recurrence is so great that if you do their 2-week, 14-day treatment of the antibiotic and you make no other changes, you're going to be back with them within 6 weeks, maybe 3 months, back at the GI saying I have the problem again. So I oftentimes have patients that have just come from GI, they're just about to go get their SIBO test, or they just had it. And it's wonderful. Do the antibiotics. We're going to start everything at the same time. We'll ramp up on some of the herbals, and then I'll be there to support when the antibiotics are over, because this is a month long process, not a 2-week process. But again, so ruling stuff out. I definitely would never tell someone not to go to a GI.
Oh, definitely. Yeah.
I tell them to go to the GI, and then let's talk about what the results are before you jump on a bunch of drugs, maybe. But I like the diagnostics, the tests.
Yeah. Oh, that's great. I think that's really helpful to just delineate like where you're falling in with those tests, and like you, I've noticed recently that more GIs are testing for SIBO, which I think is great. I think like for someone who's just, maybe they don't really have any specific issues, but and they eat a pretty clean, diet, and they've been told, well, they should have a probiotic. I remember there was something, it was quite a while ago. There was it was out of New York City or whatever, but it was an article I had read, and the one recommendation they said was, if you didn't want to do anything at all, if you could at least take a probiotic. This was quite a while. This was years ago. But what would your recommendation be for someone that doesn't necessarily have issues, but they want to choose a probiotic? How would they go about doing something like that? And should they?
So, if they have like constipation versus diarrhea, for example, there's going to be slightly different brands or slightly different antibiotics I might recommend. But generally, if someone's just wanting to throw in a probiotic, like they might throw in a multivitamin, I would say get as many strands in the probiotic as possible. They'll come with like 15 to 20 different species. Then you're covering a lot of bases, because we don't want to be like monocropping, right? We don't want to, I heard Firmicutes, Bacteroides firmicutes is good for weight loss, so I'm going to take that one like you can cause damage by taking one, even if it's good. If you're focusing on female area, bladder and vaginal stuff, there are female geared probiotics, but they're still going to have 5 or 6 things in them. So I would say, like Claire Labs has a ProThera Complete, and it's got probably 22 strains in there. So that's what I would say. I would say you want to make sure that if your probiotic is not refrigerated, that it's not supposed to be refrigerated, because a lot of times they'll sell them over the counter on the shelf, and most of them need to be refrigerated unless they have specific technology to keep them encapsulated. So refrigerated, and a lot of species variety is really the best. And then if you're totally healthy, you really have no problems, and you want to take it for a month or 2, and then you quit for a while, and then you want to maybe do it again, I would also recommend taking another brand and just really changing it up.
Okay, wonderful. That's helpful, I think.
And then the fermented foods are great, because they've got a lot of different varieties in there there's thousands and thousands of species of good bugs that we want in there. So that's where the fermented foods come in.
Okay. I love it. So with that, like, as far as fermented foods, like, How often? Like, is that
A little bit every day.
okay?
And you might need to work up to it, but a tablespoon a day or a gut shot a day, the liquid even.
Okay. Oh, I learned something new. Well, I learned a lot of new things, but that was one that I didn't even, I knew it was fermented foods were beneficial, but I didn't know how much or any of that. So, so anything before I ask you, Mila, one last question about, not necessarily about these topics, but just more about you. Do you have anything that you think we missed or that we should add?
Just symptomatic type stuff. It's definitely seeking someone like me. But if you're hopefully if you're popping a bunch of gas X, or you're popping a bunch of antacids, or you're certainly symptomatic relief is beneficial sometimes, but if that's how you're living, that's definitely not a good thing. I do have things I can tell people that they can take, like peppermint oil is great for cramping, and they even come in capsules. They use that a lot for IBS. So there's something, I'm just kind of giving people things they can do. Again, you don't want to just be living off some of these things that are symptomatic. The gas X is fine, but if you're living off that, because it's gas trapped in there, and that can be really helpful. Activated charcoal is a really good one for diarrhea, especially if you think you have food poisoning, or let's say you're traveling somewhere and you get sick. You can have activated charcoal that helps bind to the toxins and pull them out, and also helps with diarrhea. But again, if you're living on activated charcoal because you have diarrhea, you got to see somebody. What else? Yeah, so there's a few, self-help things for IBS and stuff like that. So, and then, some people throw in some antibiotic, and some probiotic, and you might want to try a few brands if you like it, and it helps your constipation, or helps your diarrhea, and it helps you, then that was easy peasy. And I would stick with that route. But if things are chronic and not changing, and you're living on some, pill, over the counter pill, then you definitely need to kind of figure that out, because that kind of inflammation is inflammation in your intestines, and that's going to lead to all sorts of other issues, down the road. Cancers, everything else. So just because it's a little bit of a stomach pain, you might, no big deal. It can really, lead to a lot of things down the road. So something to really think about.
I appreciate that. We appreciate that. So another thing that we didn't talk about, and it's not in your bio, is your teaching stuff, your continuing education.
Yes.
Will you give a little bit on that? Like what?
Yeah. So I became a provider for continuing education for acupuncturists and doctors of Oriental Medicine through our national certification board. And my first course is actually a gut health course. So I'm teaching other acupuncturists and other practitioners. Anyone can really take it, but you get continuing education, acupuncture credits for that. My next course is going to be endometriosis and bladder issues, which I might have to have you join me on that one.
I saw that. That's so exciting. So yeah, I just wanted everyone to know that you also are an educator and for other providers. And I think that's wonderful. And so thank you.
Yes.
And one other thing is, what are your favorite parts about doing what you do as an doctor of Oriental Medicine?
I love when I'm successful, when someone has gone to like 7 other doctors. I love that when people come to me and say, oh my gosh, why didn't I do this years ago? That kind of thing. And I love kind of putting the power back in people's hands. They don't have to rely on me forever. They can take their diet and they can take their supplements, and, down the road, 8 months later, they might call me up and go, hey, I'm getting, a little bit of a flare up. Should I be doing this? Is what I'm doing this and that. Great. They're like on their own. They're like driving their own car, and they're figuring it out. Every now and then they check back in, make sure that's what they should still be doing. And they've taken control of their lives and their diet, and they're no longer running to the bathroom or whatever it is they're doing. So putting the power back in my patients' hands. I don't want to make it to where you have to come see me every week for the next 10 years of your life, or, you're not gonna be able to live without me. Right.
I love it. Yes. Helping to empower people with their own health, right?
Yep.
Well, thank you so much for joining us today. I know this is going to be really helpful for everyone, and so I think it's been about 30 minutes. So I am going to I guess we'll go, but when people have questions, I will send them your way. How's that?
That's great. And you can they can email me questions and then we'll go.
Okay. Okay. Wonderful. Thank you.
Carla,
I really
that was
appreciate
fun.
you being here, Katania. Thanks so much.
Absolutely. I always enjoy it. I'll
Good to
talk to you
see
soon.
you.
Okay, bye.
All right, everyone. Thank you so much for listening. And this was so exciting having Dr. Katania here, and all her information will be in the link. And please, please let her know, or let me know what your questions are, and then I will send them her way, or send her an email, because her email is also in the link. So thank you so much, everyone. Have a wonderful week, and I will check back with you next week. Take care. Wishing you all the best in your health and wellness.